A bit of a concerning news which is coming in regarding monkeypox. The World Health Organization has called monkeypox a global health emergency. Well, the World Health Organization said that the expanding monkeypox outbreak, which has been, remember, seen in more than 70 cases, is extraordinary situation that now qualifies as a global emergency. A declaration that could possibly spur further investment in treating the once rare disease and worsen the scramble for scarce vaccines for monkeypox. Let me go across to Sharon. Sharon, of course, it's been very concerning with a couple of confirmed cases coming in Kerala as well in India, but now it's declared a global emergency. So that is an escalation by the World Health Organization.
Well, that is right, and this is the highest alert as far as any such virus is concerned when such an announcement is made by WHO. And this was, in fact, an emergency committee meeting on the virus. This was the second meeting where monkeypox outbreak has been declared as the global health emergency. Now, why this has been declared as a global health emergency is because more than 16,000 cases have been reported from 75 countries. So in a very fast pace is what the WHO believes that this is, in fact, the cases are being detected in number of cases. And like you pointed out, in India also there are 3 cases that are reported from Kerala. And keeping all this in mind, we are seeing that the WHO has declared a global health emergency as far as monkeypox is concerned. And accordingly, the Indian government is also taking all the necessary precautions to ensure that the spread of this virus doesn't spread. And accordingly, more guidelines are also going to be implemented on ground in airports and other states as well. In coming week, we are also expecting that there is going to be, in fact, a health ministry meeting with all the state stakeholders to ensure that the spread of this virus is contained.
Sharon, you must explain for our viewers what exactly does it entail when the World Health Organization calls it a global emergency. Does it also come with a set of guidelines and rules for the administration to pick up case when it comes to countering it?
Well, that is right. In fact, if you see, this classification is one of the highest alert as far as the worldwide upsurge that we are seeing. When WHO declares something as a global health emergency, it is one of the highest alerts that are globally being declared by the WHO. Accordingly, it is, of course, we will also send a guideline to all the countries to follow to ensure that these guidelines are implemented. That is the global guideline. Apart from that, India as a country will have its own guidelines, its own specific, because of the demography, it will have its own guidelines also that will be implemented on ground.
Well, let me go across to Dr. Sanjeev Bagai, also joining us, the chairperson of Nephron. Dr. Bagai, what should India be doing, considering the vaccines? There's already a race for it, and it is far and far away.
Hi, good evening. So I think the public messaging needs to be initiated. I think a public awareness campaign of the do's and don'ts and awareness of the mode of transmission. So this is a zoonotic disease. It comes through close contact, touching body tissues or saliva or secretions of animals. It's also now to be airborne, mainly through droplets. So I think we need to highlight that fact. The warning signs of fever, any pustules, any rash on the skin needs attention. It's mainly transmitted in men, gays, through the sexual route. So I think that needs to be communicated very strongly. And I think we need to make people more aware that if you have symptoms, to keep yourself isolated, get attention of a medical professional. And I think this is something which needs attention because of the very close proximity of a dense population in most of India.
Well, absolutely. Thank you so much, Dr. Bagai, for explaining that for us. Of course, it's important to be alert and not panic and follow the guidelines which have been given. Thank you so much, Dr. Bagai, for joining us. Sharon, for getting us the details.